Another area of female hair transplantation is female eyebrows, and a lot of women come in to see us having overzealously plucked their eyebrows into, I suppose, what becomes the eyebrow trend at the time. And now that we've reverted back to a slightly bushier eyebrow, a lot of women find themselves with overplucked eyebrows that eventually doesn't regrow and needs to be essentially transplanted at that stage. Not a lot of the topical treatments work for eyebrows. It's such a finite, small area that it's a very tricky area to treat topically, and hair transplantation works beautifully in that situation. Eyebrow transplantation surgery is quite a fine technique in that we really need to match up the curl and the turn in the hair that would be normally in your eyebrow, particularly in that medial brow. You don't want it coming straight out or coming in towards your nose. You want it curling outwards. So generally we take hair that is that little subtle curl at the back of the nape of your neck, which has a natural little curl in the hair itself, and it's not too coarse a hair, and that works really nicely. Again, the incision angles are hugely important in an eyebrow, if you can imagine, because you're trying to place them in a position where not only they'll use the natural curl of the hair, but that you're using the incision point to guide the hair and let it fall in a natural direction, so that they're not forever trying to tweak their hairs into the right direction afterwards. So there's a little art to that, but it's a lovely technique.